hear Sapphire uninterrupted, but you're welcome to post questions in the chat, and we're going to have 15 minutes at the end where we can actually have some Q&A, so you can ask your question verbally as well at the end. So look, without any further ado, I'll introduce Sapphire. Thank you again, and please enjoy the presentation, everybody.
Thank you so much, Chris. And before I start, I also just wanted to extend a thanks to Avni and also to Ari from our business development and marketing team at Macpherson Kelley for your assistance in bringing today together. I will share my screen now. Please let me know as soon as you can see that. So good afternoon, everybody. I'm pleased today to be speaking to managing psychological safety and workplace behaviour. In terms of a quick overview of what we'll discuss today, we'll discuss what psychological hazards are, some key officer obligations, and also some key considerations for compliance, as well as the potential direction that the law is heading in this space. So just a quick overview of my why. As Chris mentioned, I did start my career working in the Australian Union movement and was there for the first half of my career working in Brisbane and also across the country. I transitioned to private legal practice in 2019 and have been advising predominantly employers ever since. And so my real driver is how do we make workplaces safer and more equitable for all workers? In addition to my role at Macpherson Kelley, I also guest lecture on psychological safety at the Queensland University of Technology. So we know at a national level that psychological safety is a really important compliance consideration for business. Here in Victoria, we've seen some quite significant prosecutions that have occurred by WorkSafe Victoria in the psychological safety space. A lot of those tend to be in the area of workplace behaviour. So as you can see up on the screen, WorkSafe Victoria prosecuted the County Court of Victoria for failing to manage psychological hazards, which had unfortunately resulted in the death of one of their lawyers. And that resulted in a fine of close to $400,000 for failing to identify and appropriately manage psychological hazards in the workplace. Also, Hudson's coffee franchise, they had a coffee franchise that was based at a particular hospital. That particular franchise had a manager and other workers that were engaging in inappropriate behaviour towards members of the team. Although Hudson's had a bullying and harassment policy in place, there was a lack of clarity for workers on how to actually make reports about harmful behaviour, and WorkSafe subsequently prosecuted both Hudson's and also the individual manager who was engaged in that conduct, and that resulted in a fine, quite substantial fine as well. So obviously there are significant risks that can flow from non-compliance. Obviously there's the immediate safety risks to members of the team. There's also the commercial risks that result from a potential prosecution and having to pay a fine, noting that here in Victoria, if a business is fined for breach of its safety obligations, that there's actually no insurance against that. And then of course the ongoing financial risks that may result in terms of things like brand damage, loss of clients, and depending on the particular law that's breached, if it's harassment and sort of state or federal anti-discrimination laws which prevent harassing behaviour, there could also be individual liability that flows from that. So what are psychosocial hazards? Broadly speaking, these can be either a factor or range of factors that may result from the way that work is designed, the systems of work, processes, policies that we might have in place, how work is managed, how work is carried out, and of course also the personal and workplace interactions that can occur from people in a particular business. These can either individually or collectively contribute to a working environment that may cause an employee to experience one or more negative psychological responses. So just in terms of sort of conceptualizing that, when we think about how these can occur, it might just be, for example, that we are in a workplace. Some of the biggest risks that workers might experience can actually come from their co-workers. So simply just the people that we actually work with on a day-to-day basis. The next is actually job design. So, is the way that this task is designed, thinking, for example, of workers at drive-through at Macca's. You might have a worker that is taking orders on drive-through. Is the nature of the task, which actually requires them to have a high level of interaction with members of the public, designed in such a way that can create psychological hazards. The next is then systems of work. So say, for example, that, the rostering system that we have in place regularly requires workers to work a 12-hour day, 5 days a week. And so on a weekly basis, they're working 60 hours a week. Do we actually have any systems in place to be able to ensure that, fatigue is appropriately managed? Does the rostering system trigger an alert at the point in time at which a person has worked more than 48 hours, which is the safe level of maximum sort of safe hours that can be done in Victoria? And in terms then of the management of work, how are we screening the people that we are in fact putting into management roles? Are those people safe to be managed, to be managing staff? And if workers themselves are carrying out work itself, how are we making sure that that work is being safely undertaken? So just going back briefly to the McDonald's example, it might be, for example, that if a worker is working on drive-through, that there's a screen in place that separates them from members of the public. If we know that, there's a high risk of exposure to occupational aggression, it might be the case that we've got security cameras in place, that we lock the doors after a certain time so nobody can actually access a Macca's restaurant late at night. How are we actually making sure that workers are never sort of working alone on drive-through? Maybe there's other people that are working in close proximity to them in order to manage that level of risk. And then in terms of mitigating that risk of personal or work-related interactions, either between workers themselves or potentially members of the public, what are the systems that an employer is putting in place to reduce that? And some of the most common examples that we would be familiar with in the retail and fast food industry are things like, personal safety screens, reminders on windows at drive-through, to be courteous and kind and respectful to workers. And as far as, limiting cash payments, it might be that instead of the worker actually putting their own arm out, that perhaps they're using a piece of equipment or machinery to extend an FPOS machine to allow people to pay without that direct physical contact. So these are the most common psychological hazards that occur in the workplace. You'll see up on the screen hazards like low job control, poor support, remote and isolated work, poor organisational justice, other issues like low reward and recognition, isolated work, job demands, workplace relationships, as well as bullying, harassment, occupational violence, and aggression. What we tend to find from a safety perspective is that some of the most common hazards, so hazards, for example, like bullying or harassment, tend to be driven by the failure to control all of the other ones. So, for example, if I'm a worker that's got very little say over how my job is done, if I don't have a great deal of support from my co-workers, if I'm not even sure what job I'm supposed to be doing on a day-to-day basis, that's going to lead to the risk of bullying. Similarly, if there's no reward and recognition within the workplace itself and everybody is climbing over each other to get a promotion, we might be more likely to be unkind towards each other and therefore have poor workplace relationships, and that itself might also contribute to the risk of bullying. So a good way to think about some of these is that experiences of bullying and harassment and occupational violence and aggression are oftentimes the net result of a failure to manage some of these other more common psychological hazards. So in terms then of the current obligations that apply to employers, this, generally speaking, involves four main steps, which is firstly to identify what psychological hazards exist in the workplace, to assess those hazards with reference to things like duration, frequency, and severity. So how long has the hazard been occurring for? How frequently does the hazard occur? And what is the potential risk to workers in terms of the risk of potential serious harm or death if that hazard is not appropriately managed? From there, we can also consider things like how do we control the hazard and how do we review the control measures that we have in place, whilst doing all of that in consultation with workers. Broadly speaking, current safety obligations impose a primary duty of care on employers to provide and maintain for workers a safe working environment that's without risks to health and safety. This requires employers broadly to maintain appropriate plant and equipment, systems of work, give workers the information that they need to do their job, also provide adequate facilities and ensure appropriate training, information and instruction. There's also the obligation to monitor health and working conditions and to ensure that officers and senior leaders in the business take reasonable care to ensure that the company is complying with its obligations under safety law. Employees, of course, have got an obligation also to take reasonable care for their own health and safety, as well as the health and safety of others. And they also need to make sure that they're cooperating with the steps that their employer is taking to ensure their health and safety in the workplace. Across all Australian states and territories now, we have occupational health and safety regulations in place alongside compliance codes, or what are otherwise known as codes of practice, which apply to the management of psychological hazards in the workplace. Typically, the way that these compliance codes or codes of practice work is that those codes of practice in some states have also got the force of delegated legislation, so thinking particularly of New South Wales, which this year has passed important changes to their health and safety laws. Or otherwise, those codes of practice can be admissible in a safety prosecution as evidence of what an employer should have known about risks or hazards, or the means of being able to control those risks or hazards. So, what could create potential officer liability? So, if a person in a position of management is acting within the actual or apparent scope of their job with the business, that conduct can also be imputed to the breach of the company. So, in the Hudson's Coffee franchise example, where a manager was engaging in harmful behaviour towards members of the team, that behaviour is then attributable also to the breach of the company. Importantly, the court will also have regard to what the officer knew about the matter, how much of a say they could really have in decisions impacting that matter, and also the steps that they took to ensure compliance. So in the Hudson's Coffee franchise, where the manager themselves was engaging in harmful behaviour, obviously it would be quite difficult to run a defence in that particular case. So in terms then of what WorkSafe expects of officers in this area, some of the steps that officers could take could be, attending sessions like the one that you're doing today. So it's important to keep a note that you've attended today, because that's obviously evidence of a step that you've taken to help you understand your legal obligations. WorkSafe also looks at, what steps did you take to consider what psychological hazards could exist in the workplace? Did you have a method in place to stay up to date on safety issues affecting the workplace? Did you allocate a member of the team? So whether, that was a specific contact or safety person as part of your HR or safety team that had overall responsibility for psychological safety? Did you have any systems in place to be able to monitor these risks? So, for example, were you conducting, quarterly psychological safety surveys? Were you doing, regular check-ins with members of your team about psychological safety? What steps did you have in place to ensure that those processes were effective? And what other relevant knowledge did you seek out in order to inform your decision making in the area of psychological safety and wellbeing at work? So then in terms of the first step of the psychological safety hazard management process, which is actually identifying psychological hazards, there is an expectation at law that employers will identify psychological hazards so far as reasonably practicable in the workplace. Typically, before a team goes about identifying what hazards exist, I would typically recommend thinking about who's going to be involved. Is it going to be managers? Is there going to be particular health and safety representatives? Do we need to engage an external expert to assist us with that process? Because we're also talking about issues that might impact mental health, in the same way that if we were talking about issues that might impact on a worker's physical health, workers need to be assured that confidentiality is going to be maintained because they might be disclosing personal or sensitive information. And so we need to consider what sort of processes are we going to be putting in place to ensure that we can actually go about an appropriate process of identification. For some businesses, for some employers, that might require us to consider updates to our privacy policies. It might also require us to consider, how do we de-identify the people that are giving this information? Maybe instead of, getting workers to fill in a survey where they put their own name and department in, maybe, it's optional for them to give us that information. The other types of things that we might consider are, what is the type and the nature of the work environment that's being undertaken? So if, for example, we operate a manufacturing facility, the psychological hazards that are experienced on the shop floor are going to be very different to the hazards that are experienced, for example, by members of the finance or administration team. We also need to consider things like operating environment and economic pressure. So where there's a pressure to reduce costs, or where, for example, we're nearing an end of financial year or the end of a sales season, that's going to present different hazards. Some businesses also consider doing a walkthrough of, particular areas and allocating somebody to actually just simply observe what's happening in a team-based environment. Other things that we might consider are, has there been organisational change, things like high levels of resignation from particular teams? What is actually the nature of the job that we're requiring these workers to do? And does that particular nature of the job bring with it its own hazards? So take, for example, a worker that's working in a manufacturing context. If they're on an assembly line, they might be in close interaction with other people, whereas an admin officer that's working at reception is going to have really close interaction with members of the public, and possibly also a range of competing job demands. And so the psychological pressures that those workers experience are not going to be the same. And the way that we manage risks for one group of workers in our workplace is going to be quite different from the way that we manage hazards for workers in a different area of the business. So some of the other, things that we might consider is records. So have we had any workforce culture surveys done recently? Have we had any, recent workers' compensation claims which have alleged bullying? Have we analysed tasks and locations where particular jobs are being performed? Have we considered whether our KPIs themselves are actually creating risks of psychological harm in the workplace? Some things that you can do is you can actually go and speak with, members of particular teams. So what some businesses do is actually hold group discussions to speak with workers about, what their experiences are. Other employers, might conduct a survey. They might conduct that survey via providers like Culture Amp or Employment Hero. And we can also just do things like look out for significant changes in behaviour. So, for example, has a particular worker been, absent from the office for a long period of time? What are the behaviours that might have led to that? Have we checked in to make sure that if there are people that are absent, that maybe those workers are experiencing some form of psychological harm that the business needs to address. The next step, after we've gone about identifying hazards, is then to assess the hazards. So assessment is really concerned with, how likely is it that the hazard occurs? So, for example, a worker working in a healthcare context or in the social and community services sector might be exposed to ongoing risks of occupational aggression and violence. We might know from reports in the media that the risk of occupational violence and aggression is particularly high in some industries. So we assess things like how likely is the hazard to occur? How severe is the hazard to occur? So just taking, for example, the risks of occupational violence and aggression in the healthcare industry. If it's a nurse or a healthcare worker that's working in a hospital, or an aged care worker that's working in an aged care facility, or a disability services worker that is supporting participants under the NDIS, we might know that those particular workers face higher degree of exposure to occupational violence and aggression, that the severity of that exposure, in some cases can be life-threatening depending on the conduct that they're exposed to, and that the duration, it might actually go for, perhaps half an hour, perhaps an hour, depending on the nature of the exposure at that particular point in time. We might also consider then things like the interaction with other psychological hazards, which workers in the workplace are most likely to be effective, and what current controls do we have in place. So, for example, taking the healthcare industry example, we might know that in addition to being exposed to the risk of occupational violence and aggression, those workers typically are also working quite long shifts. If they're, a nurse or a healthcare worker, so they're exposed to the hazard of high job demands. They may also then be exposed to the risk of low job control. You can imagine that a nurse with a ward of 40 patients has got quite a high level of expectation in terms of what they're required to do. They may also have a low level of control over, how quickly they do it. And so we've got the hazard of occupational violence and aggression combined with high job demands, combined with low job control. And because there's, a limited number of workers in that particular workplace, we may also have a scenario where they've also experienced poor support. And so all of those factors then need to come together in order for us to be able to properly assess the risk of occupational violence and aggression. And we might say that because of the existence of all of those hazards together, because of the high likelihood of the hazard occurring, that, the risk of serious harm or death is quite high for that particular worker. We might then consider the occupational controls that we have in place. So some, facilities might consider things like allocating more staff to a particular ward or particular shift, depending on the nature of people that are in that particular ward or shift, because whilst the risk might be, high to severe if a worker is working alone, perhaps that risk is somewhat reduced or ameliorated if we've got multiple people on staff. We might also consider things like, physical alteration to the premises. So, where do we currently have our duress signals placed? Is it possible for us to have duress alarms that are actually being worn on the nurse? And is it possible for us to consider additional controls, perhaps, if we can have cameras in public places to sort of screen for, people that might be entering a particular facility, or maybe it's just a matter of having extra security on site. And then the last sort of step with assessment is how we prioritize those potential actions. So in the example of the nurse, we might say that the most important thing that we can do right now is to consider allocation of additional staff to a particular ward, given the risk of occupational aggression. Immediately after that, we might consider, perhaps it's a matter of us having additional security for particular wards. Maybe then, the wearing of a duress signal is the next most important thing that we can do, in order of which are going to be the most effective controls to help us eliminate the risk. So the next step then is to consider how we might be able to control those hazards. And so the obligation to control is as far as reasonably practicable. And in doing that, we need to consider things like how the work is managed, the plant, the systems of work, work design, workplace environment, and importantly for us here in Victoria, information, training and instruction. So simply having a policy in place and training a worker can only be relied upon if none of those other steps are reasonably practicable. So the aim for us always with safety should be to seek first to eliminate risks and hazards to prevent the exposure. If we absolutely cannot eliminate the risk, then we need to consider all of these other controls, like how work is managed, what sort of plant and equipment we have in place, the systems of work, the work design, and of course, then also the work environment. And as we sort of mentioned on the previous slide, information, training, and instruction. So simply having a policy and telling a worker, not to work unsafely by itself is not controlling the risk. And we can only do that if none of those other controls are reasonably practicable. So what sort of things do we look at when we talk about, management of risk? Typically that's looking at, decision-making structures and governance. How do we ensure that issues are escalated with the issue of the nurse? Things like workforce planning, resource allocation and rostering. Do we have people, upskilled in how to manage these safety issues? And are those senior leadership personnel themselves appropriately qualified and also taking steps to manage risk in the workplace? From there, we can look at things like replacing plant and equipment so that they present less risk. We might also consider, separating workers from plant, regularly repairing and servicing our plant to make sure that it's safe and can save time. If you have workers that are dealing with things like distressing content, we might also consider privacy screens or filters, and also consider using image recognition where there is a safety need for doing so. Other things that we can consider, again, and some you might sort of notice a bit of overlap between the various controls, is try to reduce risks associated with isolated or unpredictable work. So we sort of mentioned things like rostering and supervision, having appropriate, PPE in place. So with the nurse example, we mentioned things like maybe, nurses might wear personal alarms, and also have appropriate support in place for workers that are working either remotely or might be isolated as part of their work. In terms of work design, so that's sort of looking at, what task are we actually allocating for this worker to perform? Some of the things that we can look at are things like, is this actually the most appropriate person to do the job given their level of responsibility? Do they have the resources, the tasks, tools, and the equipment that they need to be able to do the role? And are we streamlining things where it's possible in order for us to avoid double handling and complexity? In terms of work environment itself, so we might actually consider the physical layout of the workplace. We might have good lighting and visibility, physical access barriers, in place to improve security, and also surveillance cameras, duress and alarm signals. With all of that though, because state law, so in this case, Victorian safety law, is a state law, we also need to consider what potential privacy obligations we have at a federal level and whether our privacy obligations at a federal level still allow us to put in place some of these mechanisms. So just to give you an example, we've had some employers recently in the warehousing and also manufacturing sectors where they've wanted to install cameras for safety reasons to reduce the risk of occupational aggression on site. And as part of that, we needed to consider, what sort of consents do we need from employees? Are there particular areas of the business that we would be able to film and some areas of the business which we may not be able to film? And what sort of improvements to our privacy policies or data collection policies do we need to put in place in order to be compliant with our obligations at a federal level? And also noting, of course, that here in Victoria, we've also got proposed changes to our surveillance laws flagged by the government. And so any sort of changes that we make to the physical environment to improve psychological health and safety, we also need to make sure that we're complying with other laws when we're doing that as well. So the final step of this process is then to review the psychological hazards and also the controls that we have in place. So broadly speaking, this needs to occur in a number of scenarios. Firstly, before we make alterations that could have an impact on psychological health and safety. Also, if new information becomes available, if a person makes a report of a psychological injury, or if there's a notifiable incident that occurs in circumstances where we might need to notify WorkSafe, or if, for any other reason, control measures in place are not currently controlling those risks and hazards as well as we should, or after we receive a request from a health and safety representative. So just to give you an example, let's say you've got a team, and in that team, there's been various reports of harmful behaviour. You've investigated all of those reports of harmful behaviour, and then a member of the team leaves and says, despite your investigation, all of these issues still exist, which happened after the first investigation you did. Because there's now been a new report, new information has become available to you, we should now go back and review the psychological safety controls that we have in place in that particular team to manage those risks of harmful behaviour. Similarly, let's say, for example, that we work in the construction industry and Safe Work Australia releases a new guide about how to manage behavioural harm in the construction industry. If all of our controls were put in place on the 1st of January 2026, and 3 months after we've put those controls in place, our national safety body, Safe Work Australia, releases new guidance, even though that guidance is at a national level and not necessarily specifically released by WorkSafe Victoria, because that new or additional information has become available to us, the state of knowledge in the construction industry then has changed, and we should be taking steps to familiarise ourselves with that guidance material and to consider whether we might need to make some amendments, perhaps, to how we manage behavioural harm based on the fact that new or additional information has become available to us. So some questions to consider asking yourself are employees telling us that the control measures that we have in place are not working? So in that example of a person resigning from the team, they might be telling us that the control measures that we put in place are actually insufficient. Other things to consider is, has the risk changed or is it different to what we previously assessed? So using the example of the nurse, if, what we've now done is put more nurses into a particular ward to manage the risk of occupational aggression, has the nature of the risk of occupational aggression changed in some way? So maybe, now that there's a lot of people working there, maybe lighting is still a problem. And so the nature of the risk is not necessarily that one person is working alone, but there's poor lighting and no security cameras. And so the nature of that exposure is different. And it might be then that we need to review our control measures to put in place better lighting and security cameras in particular areas of the premises where risks have been identified. The other thing is, have all hazards been identified? So if the only hazard that we're controlling for is occupational aggression, but there's also additional issues that we might need to consider. We also need to make sure that those additional hazards are also being managed for. Other things to consider is, have the people that we've been trying to support through this process actually been provided with all of the information that they need to understand how it is that we're managing these risks and hazards in that particular location. So this next sort of section of the presentation is on primary prevention of behavioural harm, and specifically looking at issues of low workforce diversity and power imbalances along gendered lines, and how that drives behavioural harm in workplaces and in the context, of course, of Safe Work Australia's best practice review of model work health and safety laws, and some of the themes that we can start to see coming out of research that's been conducted at a global level, and also some of the input that organisations have had into the best practice review process and how that may influence what happens next. Bearing in mind, of course, that at this stage, all that we have is the consultation summary for Safe Work Australia's best practice review, and the full report is only due to be released in August of this year. So just to give you some brief context, the last time that we had a national review of model work health and safety laws was back in 2019 with the Boland Review by Mari Boland, who is the CEO of Safe Work Australia. Following on from that Boland Review, we had recommendations that were made as part of the review for us to end up with psych safety regulations. And, 7 years on, most states and territories have now got those psych safety regulations in place. So typically the way that it works is Safe Work Australia will think about, what is the direction of the law? Business, unions and other groups will have the opportunity to provide input or commentary into that. Recommendations are then made, and then we might start to see that filter through into the law. At this stage, it's mainly Queensland that has got specific regulations in place around the management of harassment at work. There's also been some recent changes and developments in New South Wales around how bullying and harassment are dealt with. And at a national level, we've got our various codes of practice that deal with behavioural harm that have filtered through into some of the states and territories. So thinking then about behavioural harm, in 2015, Australia released their national framework for prevention of violence against women and children. That was released under the then Turnbull Coalition government, and one of our national peak bodies for prevention of violence, Our Watch, together with the Victorian Health Promotion Foundation, as well as Australia's National Research Organisation for Women's Safety. And that framework was called the Our Watch Change the Story framework, and it was based on this global evidence base for what we know about prevention. In a nutshell, the theory behind prevention is that we've got what's called primary, secondary, and tertiary prevention. Primary prevention is fundamentally based on the more that workplaces become more equal through equal representation in decision-making roles, the safer those workplaces become. Secondary prevention is then concerned with things like policies, procedures, and training. But on their own, we can have the best policies and the best procedures, but we all have worked in workplaces where, despite those policies and procedures being in place, behavioural harm still occurs. And the final part of prevention is then what's called tertiary prevention or response, which is once a complaint or incident has occurred, how do we then respond to it? So what we know from the global evidence base is that feminised industries, so such as healthcare, tend to experience higher rates of occupational violence and aggression. We also know that industries that don't typically have balance, so thinking, for example, like construction, mining, resources, manufacturing, also tend to experience higher rates of behavioural harm. And the theory goes that as we end up with more balance in the workplace, the research coming out of Canada suggests that it actually has got an ameliorating effect on behaviour in those particular industries. So then I guess if we look at the structure of the Australian economy, we know that by and large, there tends to be typically across the economy that more men are represented in leadership roles and key management roles. And typically what we also then, see is that the people that are experiencing harassment across workplaces, that harassment tends to be a gendered issue. We also know, just looking at industry gender composition, for example, in manufacturing, that the majority of people in the industry, both in the workforce and also in those key management roles, there tends to be a lack of gender balance in the way that the industry is structured, and that also then filters on into proportionately higher rates of behavioural harm. And that's across all industries. As those workplaces become more balanced, we actually tend to find that there are lower rates of behavioural harm. So we know from Safe Work Australia's 2024 report that women are more likely than men to experience poor work-related psychological health outcomes. they tend to be more exposed to things like work pressure, bullying, harassment, and occupational violence than men. We also know, of course, that men are more likely to be exposed to physical safety risks. So, for example, men in construction and mining are more likely to die on site. And the reason for that is that they're more likely to do physical jobs that are higher risk in terms of that exposure to physical harm, whereas the psychological risks we tend to find are more likely to be women that are experiencing them. Women are also twice as likely to experience bullying and harassment at work, which are both recognised forms of gendered violence, and that's according to a 2021 report by Safe Work Australia. Safe Work Australia's 2016 report says that harassment and bullying are common tactics used to maintain the status quo of personal power or power distribution in a workplace, noting that approximately 60% of bullying perpetrators were reported to be a supervisor, which lends itself to that hypothesis. And of course, this is all data. Not every manager is a bully. It's just looking then at industry risk factors and how those risk factors then play into how we might consider management of the risk. So at a national level, approximately 3 million workers experience sexual harassment over the past 12 months, and that's based on prevalence rates of approximately 1 in 5 workers experiencing sexual harassment, and there being over 10 million workers approximately that work in Australia. Despite that, there was less than 1,000 complaints to the Human Rights Commission made of that behaviour in 2024. And the rates of bullying are similar. So we know, based on research from Safe Work Australia, that approximately 1 in 10 workers experience bullying at work, which equates to approximately 2 million people. And despite that, there were less than 1,000 applications to the Fair Work Commission to stop bullying. So these are the hazards then that our safety regulators are most interested in regulating, which is violence and aggression, bullying, and also, of course, harassment and conflict and poor workplace relationships. And the main reasons for that is that failure to manage those hazards can contribute to the risk of serious harm or death. We know from Safe Work Australia's Code of Practice for Managing Harmful Behaviour that some of the key drivers of harmful behaviour at work are those factors that we've discussed, like low workforce diversity, so where the workforce is dominated by one gender, age, race or culture, and also power imbalances along gendered lines, so where we don't have representation of women and other people in those management roles. And that sort of goes back to that national concept of what does primary prevention actually look like? What does it look like at a national level? What does it look like at an industry level? And how do we move towards strategies to improve balance? So in industries, for example, like construction and manufacturing, we know that our construction and manufacturing employers are doing really, really hard work to try and get more women into trades. And it's really important to see those sorts of strategies as actually addressing some of these key drivers of harmful behaviour. Which is that when we have strategies to improve the pipeline, strategies to get more people from different backgrounds onto the tools, and to improve, as those people progress through the workforce and into those management roles, that these things are not just important for the sake of it, but they're actually important in terms of strategies to prevent behavioural harm in those particular industries. So we know, again, that this is reflected in the data that comes through from the Human Rights Commission and also from Australia's National Research Organisation for Women's Safety, that by and large, women and minority groups are more likely to experience harassment at work. The national prevalence is approximately 1 in 5. For these minority groups, it tends to be closer to 50%. And that's also the same with bullying, as you can sort of see some of these statistics on the screen. According to Safe Work Australia, women are more likely to be bullied than men, and that's the same across, people with disability, Aboriginal and Torres Strait Islanders, queer workers. And so the more that we sort of think about, how do we improve representation in the workforce? How do we improve representation in the industry? We know that at a national level, that's really important for actually reducing rates of harm. So just in terms of, where the law might go. So Safe Work Australia in March of this year released their consultation summary for the best practice review. Obviously, none of this is finalised, and it's still yet to be seen what the final report could look like, and that report is due to be released in August. But some of the key themes coming out of that report are whether we start to look a bit more closely at behavioural harm in the workplace and actually start to think about these key drivers as being important to address at sort of a systems and workplace level as part of this sort of primary duty of care to reduce rates of psychological harm in the workplace. So that's all that I sort of have to say about that. I'll now hand back to Chris and also to Avni to share a brief closing.
No, thanks, Sapphire. That was extremely comprehensive, and it certainly made me look at things a little bit differently in terms of advising our members. Does anyone have a question of Sapphire? I might kick it off. You mentioned the 48 hours, Sapphire, as the sort of top level in terms of hours for a safe work week. How was that figure devised, and does that include meal breaks in that 48 hours or not include meal breaks?
Good question, Chris. So how that sort of came up is that most states and territories have got guidance that they publish online on fatigue management, and it's sort of a range, right? So it's, assuming all things being equal, at what point does it start to get very, very risky for you to be working more than that? And so typically, that amount, and I'm happy to sort of put it in the chat as well, is developed by WorkSafe Victoria, and they sort of take you through an assessment of, 48 for one worker may not be the same for every worker, but, all things being equal, after that is the point at where it starts to become quite hazardous. And I would actually probably go a step further in saying that there's a bit of a disconnect between the Fair Work Act, which says, 38 hours a week is your ordinary week, but some modern awards allow you to work, up to 12 hours a day and up to 10 hours a day, depending on the award, with agreement from the worker. And then our safety regulators, on the other hand, saying other things. And so I actually think that, part of the issue for a lot of businesses, particularly thinking of heavy industry and also, businesses that employ shift workers, is that at what point is it unsafe? If I'm a paramedic working 60 hours a week, is that unsafe? And it's just, perhaps I can just share with you the guidelines and share my screen.
Yeah, sure.
Okay, there we go. So let me just bring it up. All right, so let me just share my screen. Let me know if you can see that.
Yep, I can see it.
Oh, yeah, there we go. So they have got a risk assessment that you can do. And that risk assessment is based on, how much is a particular worker working. And so can you sort of see this over here? So if it's sort of less than 48 hours, we might sort of be, the minute that it gets to a bit higher than that, you can start to see that it's now getting into the realm of higher risk.
Yeah.
So I'll put this into the chat.
That's cool.
Yeah, hopefully that gives you some indication. But look, the truth is that all states and territories have got their own guidance material, and that where that sort of sits for a particular worker, for a particular work group is going to change. I know that Sue and Dewal have also got their hands up. So
after you, Sue. Me first. Okay, thank you. No, that was really, really interesting. Thank you, Sapphire, and thanks, guys, for putting this on. Um, I'm curious to know because I'm appalled at the statistics of how many um, incidences and how many are actually then being reported. It's almost like a 20th of the population. Um, so I'm curious because with my business that with Jim's Life Coaching at the Jim's Group, when I was putting my workhouse or my divisional specific manual together that we have to do, the gentleman who did that does a lot of work in compliance and work health safety and all of that sort of stuff. And he said, Sue, your programs are help manage the psychosocial hazard for companies. And it's like, do we need to have, like, how do we know, or how can we go to companies and say we can help with prevention? We can really help going into, I know it's that third part of the wheel, putting the safety stuff and all that first, but I know what we do can really help stop a lot of behavior from the people who are actually instigating it rather than protecting the person who is being attacked. We can work from the other angle altogether. Do we need approval to get that done? How do we get recognized? Is there a tick of approval that comes
Yeah.
through
So look,
the...
what I would say is this. So I think training is useful. I don't want to say that it's not. I think it's useful because it builds awareness, right? So all of us today are sort of taking the first step of how do we become more aware of issues, because that then empowers us to address them. So what I would probably say to you, Sue, is I would be a bit reluctant to guarantee anybody a silver bullet and say doing this training is going to make you compliant, because I think that the way that psych safety is headed is that management of behavior is so much more than just I've trained you and now for the next 12 months nobody shall be bullied at work, because that the reality is that does not happen. You do the bullying training once a year for an hour and then we all go back to bullying everybody that we were bullying before we did the training. So I think what I would be more likely and more inclined to suggest is thinking about how you might say this is just one step of your compliance journey, which is awareness. And awareness is a really important part of compliance, but by no means is it the be all and end all of compliance.
Mm-hmm.
Does that help you?
Yes, it does. It does. Very much so. I just see a lot of trying to protect the person who is being bullied, which is 100%, oh my God, needs doing 100%. But then it's the prevention. It's like putting people in jail for committing murder. It's like, can we prevent that from happening in the first place? Which is very much where we come from. And I know it's only one step, definitely. But it's like, well, where do we go to be part of that one step?
Yeah, for sure. So, I mean, I think some things to think about is, you'll remember one of the first slides was talking about how, bullying and harassment are sort of the end result, and that there's often, other pieces of the pie, like you're getting me to work 50 hours a week, so I'm tired and I'm cranky. And I also don't have good support for my co-workers, and I also don't really know what job I'm particularly doing. And I'm also the only woman in construction in the team. And so it's all of those things together that are combining together to make it more likely that I'm going to be bullied. If we start with thinking about what are the different aspects of my job that could contribute to an environment where I am bullied, maybe we start with managing hours of work so that my co-workers are not so cranky. Maybe we then think about, the government's got this great program to get more women apprentices and low workforce diversity as a risk. So how do we think about pipeline? And so it may not be that we solve all of the issues today, because that's unrealistic, but it may be that we put in place strategies to address the other hazards that are contributing to the risk of bullying.
Yeah, possibly government could play its part by reducing some of the regulatory imposts that it puts on business. And that extra time that business owners and workers have to take. But on to the next question. Dewal, are you still there?
Yeah, I'm here. First, justify amazing presentation, very, very comprehensive. Literally, you can take all of this and do a risk assessment, start the proactive risk assessment. So yeah. Now, through my past and current experience supporting clients in health and safety, one thing that pops up is legal professional privilege. And I just thought it'll be worth kind of getting your view on that, especially that it does protect you from sharing that information to the regulator, but also in a way puts you on the back foot, especially when you're trying to demonstrate you've done or you've taken certain action or your due diligence. What are the ways that businesses could navigate uh, the legal professional privilege aspect, but also then be able to show that we've taken action in relation to certain aspect of psychosocial hazards that the regulator could be investigating in the workplace?
So that's a great question, Dawal. And I think it's so good that you asked it because that has come up for me with a number of clients. And it's always this balancing act of we want to protect the business from having WorkSafe on site and WorkSafe saying that we want to see all of your sins, produce them to us so we can prosecute you, which you don't want to do. Why would I want to give WorkSafe my deepest, darkest secrets, right? So what I've typically done in that scenario is where we've partnered with business to help with psych safety implementation is I've drafted a script for, say, like a HR manager, and I've got the HR manager to say before their like work group meetings to identify psych hazards that we're doing this for the purposes of the company being able to obtain legal advice on how we can put in place appropriate safety measures. So the consultation still occurs, but instead of us having a survey which can then be produced, we just have a consultation record which has been prepared for the purposes of legal advice. And coming out of that, we then have a more limited series of identifiers which have been done under privilege, right? And so we might end up with a separate document that we would be happy producing, which is like a one-page summary, which makes no reference to the first document that was prepared for the purposes of legal advice. So if WorkSafe came on site, we would still be able to give them something to say that we've identified hazards, but we may not be producing for WorkSafe a 20-page survey, which has every department and every grievance that has turned up, because giving them that, you know, if you have a workforce of say 500 or 1,000 workers, like we're sort of heading down a path of how do we control for every risk. But I'll also mention on that point as well, Dawal, that there's a bunch of sort of psych safety providers out there that are sort of saying to employers, we can track your psych safety risks in real time and we will fix them in real time because you'll have real-time data on how to address these issues. As a safety lawyer, I get very nervous about that because I know my clients and I know that as well-intentioned as they are, their teams are like really resource constrained. And if they have daily reports about psych hazards in all areas of their business, as much as they would like to be actioning those things immediately, the reality is that it's probably not going to be possible. But it creates all manner of risk from a safety perspective about, you know, you knew about all of these risks in every area of your 500-person business. Why were they not addressed? And there's really no good answer to that question. So I sort of, if we were to partner with a business, we would think about a more sustainable way of keeping on track of those issues through quarterly consultations that are guided by your lawyer, where we sort of strictly control how much of that is actually put on record.
Yeah, yeah, I think that makes absolute sense. In my past life, I've issued notices when not citing investigation reports. So essentially, give us an extract of it, which of course you want to protect beyond what you want to protect, to show what actions you've taken. So which directly, literally means what you've just explained, a supplementary or a complementary document that supports your actions. Yeah. No, thank you for that.
Because it just becomes like a nightmare. And I just know, even with the best intentions, my clients are busy people. They're not going to keep on top of a daily notification of every single psych safety issue in every area of their workplace, even if they wanted to.
Yeah, thank you.
Thanks, Dawal. Any further questions of Sapphire? Doesn't look like. I can't see any hands up, but look, without any further ado, thank you, Sapphire. Great presentation, very enlightening, and I think, as Dawal said, on the basis of that, people can start building their response to these regulations. We are looking at having a second session on this where we get together in person and have a couple of our OH&S advisor members, as well as Macpherson Kelley, as part of a roundtable, give advice, and Dawal, you're one of them, as well as Rebecca from Soteria. So we're looking at that the next couple of months, so please stay tuned for that. In terms of this particular webinar, we can make it available to you if you've missed bits. We're looking at also posting it on the website. In terms of future Northlink events, we have our NBAA breakfast coming up, talking about health in the region. We've got Robin Penty, CEO of the Ovarian Cancer Research Foundation. She actually lives in Melbourne's north, and we'll be talking about her journey and the work of her organisation. We did sort of briefly touch on AI before we opened this particular webinar up. We are looking at having a major AI summit as well later in the year, late October, so please stay tuned for that. So without any further ado, thank you again, Sapphire. Thank you all for attending, and have a good rest of your day. Thank you.
Thank you so much, Chris.
Thank you, everyone.
Ari. Really appreciate it. Thank you, everybody. Goodbye.